Shared care, I think, is really about how we build, in some ways, a true medical home for people, and how we really make sure that our patients are getting comprehensive, hopefully non-redundant and effective care from the healthcare team around them. And at the heart of it, it's relationships and communication. Yeah, certainly the work that, as I mentioned, as working as GP specialist in diabetes care was done somewhat through shared care, and they were really supporting of that as our kind of got identified by our internal medicine specialist locally that he didn't have the capacity to do that, and thought that I would do quite well in that, and was a big support in trying to find the care for patients to fill that gap. And I'm on the steering committee for Partners in Care, where we're looking at a number of different specialties and the interaction between GPs and specialists. You know, sometimes it's even just with patients in my daily practice, just telling them that, you know, I'm trying to do what I can to make some change. So this area where, if it's around an issue that they're really struggling with, saying, you know, trying to do what I can to leverage this position to make some changes that hopefully overall we won't have to deal in the future with these kind of barriers. And then just certainly within the clinic and within you know, my medical staff, just trying to bring them up to speed and let them know some of the opportunities and things that we're working on. You know, I think in shared care, the local kind of experiences just of being a fairly rural, isolated community, and the challenges of travel, especially in the wintertime with snow over mountain passes to access care, is something that really is a unique lens that I try to bring to shared care and to some of the bigger meetings to look at, because, you know, sometimes if your patients won't even go to the care that they need because they can't access that and travel that, I think that for me is one of the hugest barriers. And again, that's not as applicable for urban GP and specialist relationships or family physician specialist relationships. Well, as I mentioned, you know, in regards to the challenging access for patients to specialty care because it's traveling, that's been something that's been on my mind a lot, because I have both even friends and patients that talk about having to travel 6 hours to see often a subspecialist, because we have a core group of specialists in our community and nearby, but often traveling, you know, upwards of 6 hours, and sometimes to Vancouver 8-9 hours for fairly brief consults. And that seems pretty onerous for them. And so I've been looking for solutions in that area. Fairmountain was one of the areas I was discussing earlier, and the kind of outcome that I got was a specialist in Victoria who's actually been working on the same kind of thing was telling me, in fact, some of the fee codes are in place now to allow video or teleconference to do that, and both how, you know, a GP and the specialist on the other end can get remunerated for the work that they do in that relationship and in that consult. And also it's actually an app for iPhones, or a computer program that's being developed and about to be beta tested in the next month, that has secure encryption on the level of what banks use to ensure that patient data is not potentially at risk, and can use that program to communicate with specialists face-to-face with the patient, either in the room or at home. And so the ability to have the technology and a model of remuneration to look at trying to do a new system where I don't have to send patients on a long, long journey through the snow over a mountain pass to see the care that they need, but do it in a different way, I think for me was a huge, huge gain from the morning so far.